Hey there, this is Dr. Ezi. I'm trying to help you to pass the MRCS Part B examination. We are going to discuss the parotid gland examination stage. But before we start in that, we want to mention two things. Number one, in every examination station, remember the wiper, okay? And the wiper is a common killer for the candidates. So wash your hands, introduce yourself, take permission, expose the part you want to examine, and reposition the patient to the position that you need for examination. And in the parotid gland examination, the position is upright, sitting on a chair. Okay. There are special two killers in this station for the candidates, and you want to know them. This parotid gland examination. It is a very easy station. You can get the 20 marks so easily, but you have to remember 2 points. First of all, you want to examine the contralateral side. If you forget to examine the contralateral side by making inspection or palpating the contralateral side, you will lose the station. You get 0, okay? The second point that most people lose the station because of it is that they forget to examine the facial nerve, because if there is a pathology in the parotid gland that is involved in the facial nerve, most probably this patient has malignancy. So it is very important. So if you miss any of these, you will miss this easy station, okay? So after you have done your wiper, you are going to do the examination. And in this case here, the examination will be of 2 parts only. You will have an inspection and you are going to have a palpation. Okay. There is no percussion definitely, and there is no auscultation either. Okay. So in this case, in the inspection, you are going to start with the 6S: sight, size, symmetry, skin, scars, these things, okay? And next, you are going to, I will make it for you by another color. Look at the contralateral side, okay? Next to that, directly, you are going to examine the facial nerve. Okay, these are the 2 killers. You have to remember that. Okay, so for the facial nerve contralateral side, you are going to look to the 6S also, and for the examination of the facial nerve, you are going to do the 5 things that will show you the facial nerve is functioning or not. You are going to ask the patient to raise his eyebrows. You are going to ask him to shut his eyes strongly, and you try to open them against resistance. If you couldn't, that's a good sign. And you are going to ask him to blow his cheeks. You are going to ask him to show you his teeth, and you are going to ask him to tense his neck muscles. Okay, these are the 5 things that you are going to ask for facial nerve examination to check that the facial nerves are functioning. And finally, in the inspection, you are going to check the oral cavity, okay? And in the oral cavity, you are going to focus at the level of the upper second molar tooth, where the opening of the Stensen's duct is there, okay? So if there is some stone sticking there causing the swelling or the pain of the parotid gland, it could be at the gate there, at the opening, fine? So next to that, you are going to go to the palpation, and in the palpation, you are going to first of all take permission from the patient. I'm going to write this golden also. Permission from the patient that you are going to examine him from behind. Okay, as you know, all the neck examinations are from behind, all of them. Okay. So take permission first, this is the first point, and the second point, you are going to palpate the lung, okay? So on palpation, this palpation, okay? It's normal palpation, a gentle palpation that you are going to use the palm of your fingers and put it there and try to see what is going on there. So on palpation, you are going to see The surface, consistency, fixity, tethering, edges, pulsatility, these things that you know about the lung. You are going to do this as the patient is relaxed, and you are going then to ask the patient, let me change the color here, and you are going to ask the patient, first of all, patient is relaxed, and after that you are going to ask the patient to clench his teeth, that he stretches his facial muscles, so that if there is a lump or abnormal tumor or something like that, it will be more apparent, you will see it better, and you can feel it better during your palpation. So in this way you are going to know what's going on the parotid gland of that you are considering. The third point that you want to consider here after this palpation are the lymph nodes. And as we told in all the stations of neck examination or glands examination in this area, you are going to examine all lymph node groups, superficial, deep, all, okay? The next point is that you are going to palpate the duct, the stencil duct, okay? And to know where is the duct, you want to know that you are going to draw an imaginary line from the tragus of the ear to the frenulum, or the midline point above the lip and below the nose, okay? This depressed area. And this line, after you draw it, you are going to divide it into 3 parts, okay? The middle third of that line represents the stencil duct. Okay, so you are going to examine it from outside, and you are going to examine it bimanually. That is why the next step is bimanual examination. So by manual examination, you are going to examine the duct, and you are going to examine also the examine the gland from you are going to wear a glove on your, let us consider that the patient's gland which is sick is the left one. So you are going to wear a glove on your left hand and insert it inside the patient's mouth gently after permission. And you are going to put your other hand on the outside, and you are going to start to palpate, okay? So this is manual examination by both hands, from outside and inside. And finally, you are going to, as we told before, you are going to palpate the contralateral site. So you cannot palpate the facial nerve because it is just an electrical examination, but you have to palpate the contralateral site, okay? A short discussion after that will happen with the examiner, and the examiner is going to ask you what is your differential diagnosis. And in all cases of swellings, you have to consider the grades of differential diagnosis. The first should be, in your mind, should be infective cause, like parotitis. The second should be an inflammatory, I mean here, chronic inflammatory, like Sjogren's syndrome, Mikulicz syndromes. These are chronic diseases that may involve the parotid gland. And you should consider then benign neoplasms, okay, and benign neoplasms like pleomorphic adenoma and Warthin's tumors. And finally, you are going to the malignant or the cancers, okay, and you could be dermoid carcinoma, adenoid cystic carcinoma, adenocarcinoma, lymphoma, these things, okay. Then after that, he is going to ask you about the investigation. So this is the differential diagnosis. He is going to ask you about the investigations, okay. And the investigations in this case, because this station most probably is involving a pleomorphic adenoma, so you are going to go directly to the trivial assessment. You did your examination, now you are going to do radiological studies. You are going to do an ultrasound, you may need to do a CT scan, and you may need to do an MRI to know the extent of the tumor or what's going on there, especially if there is suspicion of malignancy. And then after that, you are going to define needle aspiration cytology. Okay, these are the main. So there are CBC, these things. If there is infection or inflammation, this is another thing, that if there is a suspected infection. But in this station, it is most probably a benign tumor. Okay. So after that, they are going to ask you what is your treatment if this patient has pleomorphic adenoma. What are you going to do? And your treatment should be superficial parotidectomy. Parotidectomy, okay. So this the whole talk, and we'll see you later.